I'd like to thank everyone for joining us today for the Western Center for Ag Health and Safety's April seminar. Really looking forward to having this conversation. Next slide, please. Couple housekeeping items. This seminar is being recorded and will be available on YouTube in both English and Spanish in the next few days. All participants are muted. However, we welcome you to use the chat function to submit questions or comments, and I'll facilitate a conversation with our speaker at the end of the presentation. And once again, interpretation is available using the world-like icon at the bottom. If you have any trouble, just let us know via chat. Next slide. For those of you who have not joined us before, welcome. We are the Western Center for Agricultural Health and Safety based at UC Davis, and our mission is to improve the health and safety of agricultural workers in the West. And we do this through research, trainings, and outreach, and we use this seminar series as a way of disseminating really important information about workplace safety broadly. Next slide. Also really excited to make you all aware of a new website that we've launched. It's called Campo Seguro, and it's a website that we created with and for farm workers. You can learn more about the site at camposeguro.ucdavis.edu or by scanning the QR code. And I encourage you to go back to it often because we have new topics that will be posted on the site in the near future, including valley fever, the topic we're going to discuss today. Next slide. I'm really happy to introduce Dr. Abascal, who is at UCSF as well as the Department of Public Health in California, and she's going to talk about valley fever in California. I will pass it over to you, Dr. Abascal.
Thank you, Heather, and thank you everybody for being here. I'm just going to go ahead and share my screen. And share. That looks good. Perfect. Thank you. So before we start, I just want to preface this presentation with my own experience talking about valley fever. I am originally from Mexico. I trained as a doctor in Mexico City before coming to UCSF and CDPH and continue my education and my PhD. And despite being trained as a primary health provider in Mexico, I didn't have, besides learning in medical school and knowing that it was in some places in Mexico, I didn't have a close experience with valley fever. And just continuing public health, my public health work here in California, similar, it's an issue, and I know there's a lot of people at CDPH working on it. I've been working a lot with the Western Center in different things, and this has come up. But they invited me to give this presentation in Spanish, which I promise I speak better Spanish than English, and that would have been a funnier version of me giving this talk, but I'll do my best. But when I was invited to give those talks on valley fever for community members, for farm workers and agricultural workers in California, it really struck me as, wow, like this is huge, this is important. And not just because of like the questions and the interest that this topic generated with the people that were listening to me, to us, but also because of the strong stories we heard of them. So many first-person stories of valley fever, experiencing valley fever themselves, knowing people that have died of valley fever in their work. So really, that was like an eye-opener, definitely, of like, this is a big issue for this population. So thank you so much for being here today. Thank you for Western Center for holding these important topics, not only for community members, but also for people that are joining here today. And lastly, CDPH and the work they've been doing. You'll see the slides are amazing. I don't take any credit for them. I'm just a voice, but all the amount of work that goes into it, into the Valley Fever group at CDPH is amazing. So thank you very much. And just as they were saying, just put your questions in the chat. With my students when I teach and when I give talks, I do ask people to ask the questions in the chat, in this case, as they come to their mind. Sometimes when we save them for the Q&A, we forget. If it gets answered later, it's fine. we'll just say it's been answered, or maybe that question is not as important anymore. But still, if you have a question, ask in that moment, because if not, like we tend to forget. So, okay, let's jump in. Mm. Listo. So let's start by defining what valley fever is. So valley fever, it's a disease caused by a fungus. Valley fever has been called and is called by different names. The name of the fungus that causes it's this one. It's super complicated. I'm going to try. I always practice and I can't speak. So it's coccidioidomycosis. That's the Spanish one. I'm not even going to try it in English. We just call it cocci for short. But other names for this disease is San Joaquin Valley fever, desert rheumatism, California fever, enfermedad de California, and enfermedad de Posadas Wernicke. Uh, all of these are the same disease, and it's a disease caused by cocci. I think I stopped presentation mode. Give me 1 second. Okay. So throughout the presentation, these little orange spots you see, that's going to be the visual representation of cocci or the fungus we're talking about. And we'll use that throughout. So if you see them, that's what we're trying to see. So just here, you don't have to answer this question, but just like a knowledge check, or you can use a chat if you want to use a chat. We would want to know what do you know, what you've heard about valley fever, because surprisingly, a lot of people haven't heard about it or don't think it's that important in the place they work. So we can take 1 minute if somebody wants to jump in the chat, and if not, we can just answer this later. Okay, so we have one comment here that once you get Alejandro, once you get valley fever, there is no cure for it. Okay, let's see about that. I don't want to spoil the surprise. I know that was not very informative, but I'll promise we'll get there, Alejandro. And then Catherine said that the fungus is extreme resilient, so that when we talk about disease that's resilient, we're maybe talking that it's very resistant to treatment, that it can last a long time in the body. Edgar mentions that it's specific to the valley, caused by a fungus. There is no cure. That's a question. Um, that's a good, Edgar, like it's specific to a valley. Yes, but it's not the only place to where that is. And we also talk about geographic location. We also have some other comments here. So thank you. This is great. So climate change is creating circumstances that will make it get worse. Yes. Adriana is saying that she hasn't heard of it before. And Karen mentioned that it's endemic to her county. Araceli, it can kill you, incapacitate you, and can be cured. And here we have other information. It spreads through the air. So thank you, thank you. These are all great comments. I'm happy to tell you that we'll cover, I think, all of it in the talk. So hold on to your questions if they continue to be questions after I give this talk. So thank you very much. So let's see. Perfect. Okay. So as I was saying, valley fever is caused by a fungus that grows in the dirt. So here we have it living as a really, really small in the dirt. It's not visible to the human eye, and that's important to know because many times when we think of fungus, and especially the Spanish translation, which is hongos, which is just like the general term we call, like for example, mushrooms weed. People assume that that is they're visible, right? So they think of like just like mushrooms growing in the sand. That's not the case for cocci. Valley fever fungus grows in the dirt, and when the earth, when the ground turns into when the dirt turns into dust, so when it like gets up in the air, that's when the fungus, that's how it gets to the air, and that's when people and animals, important here, can breathe in the fungus. So it's usually here, and then suddenly there's a terrible windstorm, or the air, it's very dry, it hasn't rained, so that makes the earth smaller, and that raises, and that's when we breathe. And the issue is that once we breathe it, it can go to our lungs and can make both people and animals sick. So super important distinctions here. Valley fever is not contagious. Valley fever is not contagious. You cannot get it from a person or spread it to a person. So it's not like COVID or like the flu where we can just like breathe out and someone breathes it in. It's also not contagious from animals, insects, foods, or pesticides. The valley fever, as I was saying, is not visible in the dirt. It's not a fungus we can see because it is too small to see. So it's imperceptible to the human eye. So, as I was saying, valley fever is common in some parts of Mexico in the north and some more arid places, Arizona, but in California and within California, it is most common in the southern San Joaquin Valley and the Central Coast, but it is also common in the northern San Joaquin Valley and parts of southern California. So that is where we see valley fever here in California. So as you can see, it's a very big chunk of the state. And as some people were mentioning in that chat, climate change, different climate patterns can also change this. So who can get valley fever? Anyone can get valley fever. Even young, healthy people can get valley fever. Outdoor workers or anyone around dirt or dust outside are at most risk because remember that that little fungus is just floating in the air. So the more exposed you are to that air, the more likely you are to get it. Um, and here an important thing, like even though outdoor workers are at most risk, like if you're like a kid that plays a lot in the dirt, like that can also be. So like the major risk factor is being exposed to the dirt, and because outdoor workers are more exposed, they're at more risk. Even farm animals and pets can also get, including dogs, can get valley fever. And people can get valley fever at home, at work, at school, while traveling. They can even get it from by staying like a short time or in a short visit or passing through a place where it's common. So like think of like, oh, I'm driving through and I have my windows down, dirt comes in, I can also get it. And people can get the valley fever even if they lived in a place where it's common for many years. So if you've never had valley fever and you live in a place where there's a lot of valley fever, you can still get it. And the same thing happens the other way around, right? Like you can live in a place where there's a lot of valley fever and never get it. So anybody really that's exposed to it can get sick, but also you can not get sick, you know? So it's like not everybody that lives in that area has valley fever. So how does valley fever present itself? What are the symptoms? So valley fever usually think of it like it goes as we saw in the picture. It goes through your nose. It goes through the air we're breathing. So the first stop it makes is the lungs. No, so valley fever usually affects the lungs and can affect someone's breathing. So it can cause respiratory symptoms. For example, cough, trouble breathing, chest pains, valley fever symptoms don't start right away after someone breathes in the fungus. So it usually takes between 1 and 3 weeks after breathing the fungus where we start to see these symptoms. So it's not immediate. Like it's not like I breathe it in. Like think of like an allergy where you like breathe it in and instantly your body reacts. This is not that way. So you might breathe the valley fever fungus, and then wait 1 to 3 weeks and then start seeing the symptoms. And that's because of how the fungus is growing inside your lungs. So we talked a little bit about the respiratory symptoms, which are usually the most common, the first ones, because that's the first stop of the fungus when we breathe it. But it can also, so I don't know why it keeps so, but it can also include other symptoms, including fatigue or exhaustion, cough, trouble breathing with where the respiratory, but it can also later cause fever, night sweats, muscle or joint pain. That's why there's a term in like the rheumatology, like that name we heard that had like a rheumatology word. That's why it comes from because of the pain in the joints it can cause. It can also cause chest pain, weight loss, and rash. No, it's a rash that usually starts in the lower legs and the shins. So as you can see, though, even though it starts as respiratory symptoms, and those are the most common ones, we can see how as the disease progresses, it can cause more full body symptoms. So as you can see, just going back here to introduce the next, you can see that these symptoms are pretty standard. Like if I go to the doctor, I call the doctor and I tell them, my kids or me, we're coughing and we're having trouble breathing, we have fever. The first thing that might come to their mind is like COVID or flu, no, or like some infectious diseases, and that's something that happens a lot with this disease. Since its first symptoms are not very specific, it can take a long while to diagnose. It can take a long while for the people to search healthcare or talk to their provider, and it can take a long time for the providers to diagnose it. So that is very important. So how is valley fever diagnosed? As I was saying, like it's looks a lot like in other respiratory illnesses. The symptoms of valley fever can look just like the symptoms of a flu, a bad cough, COVID-19, or bacterial or viral pneumonia. You need diagnostic tests from a healthcare provider to find out what is causing these symptoms. You almost always need a blood test to check for valley fever. And this is very important because it's not like with COVID or flu where you can get a nose swab and get the results immediately, or that there's like tests that are available over the counter. Here you do need a blood test that's looking specifically for valley fever. Um, yeah. So here we have the test and how you have to look at in the blood. So what happens if I or someone else gets a valley fever? So most people, and this is also important to note here, most people who breathe in the valley fever fungus don't get sick. Okay, and that's why people that have lived all their life working outside with valley fever might never get it because most people don't. Uh, and of those who get sick, most of them get better on their own. Okay, so like, okay, maybe I got a little bit sick, but I didn't need anything. I never went to the doctor and I got better. Uh, and most people who do get sick get better on their own. Yeah, only some people need antifungal treatment. So there is a treatment for valley fever, but not everybody needs it. And this is a medicine that's used to fight infections caused by fungus. It's the same medicine as other fungal diseases, including valley fever. But so then you would ask like, why then is this important? Now you're telling me that most people won't get sick. Then of the people that get sick, most of them won't have serious effects, won't need even treatment. And then you're saying to me that like for people that need it, there's a treatment. Yes. But here's like the big but. There are still people that have very severe outcomes. And so that is why it's very important. So if I get valley fever and I stay home and I'm fine, I don't need anything else, how can I care for myself at home? Uh, and this is because it's such a big chunk of the population that gets valley fever that will stay home. So there are no home remedies for valley fever treatments that you can get over the counter. So if you do need medicine, it has to be a prescription. But the good thing is like most patients get better with rest, drinking water and fluids, and just like managing pain and fever with like Tylenol or Advil. So here's the big question, right? So like, when should I see a healthcare provider? Now, if you're saying like, it's like most people get better at home, then like a very important piece of information is like when to seek care. So you can see your healthcare provider at any time if you're worried about valley fever or any of your symptoms, and that's always an important thing to note. There's not like one specific thing that you should wait for. If you're worried, you should ask your provider. But you may want to go see like your provider sooner if you don't get better after 7 to 10 days or more. So that's like a good frame to think of, like over 1 week, over a week, you should definitely seek care. If you're missing too much work or school, so your symptoms are too bad that it's affecting your day-to-day life, and your symptoms get worse, especially trouble breathing or severe headache and neck pain. Uh, and this is important because getting diagnosed and cared for by a healthcare provider sooner may help prevent severe disease. So we know that, like, for most people, the disease stays in the lungs, but then can spread to other organs, and that's disseminated disease, and that's where we would be worried. Because valley fever can be severe, and patients may need to be hospitalized. Uh, and this might impact like their work or their school for weeks or even months. And in very rare cases, valley fever can lead to a lifelong illness, or it can be fatal. It's very rare cases, but it can happen. And just like for context here, in California, over 1,000 people are hospitalized with valley fever each year, and over 80 people die of valley fever every year in California. So that's a significant number, given also like the additional risks and barriers that people that might be exposed to valley fever face. So who is at risk? Who can have severe outcomes? Anyone can have them, but there's certain people that might have a higher risk. And this includes people 60 or older, pregnant people, people who are Black, Filipino, Latino, or Hispanic, people with certain medical conditions that increases the risk. For example, diabetes, hypertension, conditions that weaken the immune system, including diseases that weaken the immune system, but also people that, for example, have chemotherapy because they have cancer or are taking steroids for another autoimmune disease. So anybody that has like a weakened immune system can also be at a heightened risk. So how can I reduce my chances of severe disease? We don't always know why some people get severe disease and others don't. Um, so it's important here to watch for lingering or long-lasting symptoms or symptoms that get worse, including increased trouble breathing, severe headaches, severe pain in certain parts of the body, including joints, back of the neck, skin lesions that may look like large bug bites, or a wound that you didn't get and it isn't healing. So like if it's like in your skin, as I was saying, mostly in the shins, so a wound that like doesn't close. Um, so you should definitely see a healthcare provider if you have any concerning symptoms. It's important to follow your healthcare provider's instructions, including follow-up appointments, repeat blood work or scans, and treatment. And this is important because, as we were saying, for people that have disseminated disease or like a worse case of valley fever, it might take weeks or months to clean out the disease. And this might include repeated blood work and a long treatment. So that is why, like, it's not like oh, here's your medication and you can leave. Here's your antibiotic, take it for 10 days and you're fine. This is like a disease that needs to be managed closely with your providers. That's why following the instructions of providers is going to be very important. And for valley fever, it's common for your healthcare provider to watch you closely, even for years. Uh, and that's why we get like follow-up appointments, repeat blood work and scans that help for this. So a question we get a lot is that if someone has valley fever, we even saw it in the chat. No, if someone has valley fever, can they get it again? So the big answer is no. But remember, there's always almost no absolutes in science and medicine. So for most people, no, their immune system can remember the infection and protect them towards getting it again. So most people will only get valley fever once in their lifetime. But in rare cases, the valley fever fungus can stay in someone's lungs, and even even after they get better. And if later on they're, because I don't know, like they got valley fever, they had a little bit in their lungs left and they were fine, they had no disease, but they get cancer and they get chemotherapy and their immune systems goes down, then the fever symptoms can come back. I do want to emphasize though that this can happen. It is extremely rare and most people don't get it again. So how can I protect myself? How can we protect ourselves from valley fever? It can be hard to prevent valley fever because it's difficult not to breathe, right? Especially like, I mean, that's obviously it's impossible not to breathe, but it's difficult not to breathe in dust outdoors. And there is no vaccine for valley fever. So like we don't have like a preventive like treatment like a vaccine that helps us prevent it. So the best way to protect yourself is to avoid the dust outside in places where valley fever is common. So am I saying stay inside forever? No, that's not what we're saying. So what we're saying is just like try to stay inside as much as you can when it's windy or dusty. So when there's a ton of wind, a ton of dust, that's where like the risk is higher. Close your car windows and use circulating air. So that's also like big one. Like if you're driving outside, there's no need to expose yourself. Just like close the windows. Cover open dirt near your home with plants or ground cover. So what is especially risky is like dust that can go up with air. So if you have plants, if you're like if it's wet, if it's packed, it's less likely to rise up. We know that not everybody is privileged or like their work and everything, and they must go outside. So if you must be around dirt and dust outside, including being an outdoor worker, it's important to consider wearing N95 respirators this size, which are the ones that should fit really well. Like some of you might remember them from COVID. So it's not just like the face back; it's the one that like actually like covers everything. N95 respirators have been proven to filter out small particles from the air. So like the particles, if we just wear like a cloth or something, like the fungus can still go in. Um, Even though they provide a barrier, they don't provide the same level of protection as an N95 against these particles. So outdoor workers should consider, and the workers and their employers should consider wetting soil before digging and disturbing it before moving it, because like wetting it packs the dirt together, so it's like less likely to just like rise on the road on its own. Also important, changing any clothes with dirt on them before entering the home, so you don't bring the fungus into your house. So like if you've been working outside, and maybe you were really good and you wore like a very good respirator and everything, but then if you take out your shirt and just like the dust flies everywhere, that's also a risk. Employers of outdoor workers should also consider these steps to help prevent valley fever. Planning jobs to avoid the dirt disturbance, like digging or grading. So if we know it's especially dirty, if it's especially dry, if it's extra windy, then we should plan the jobs so that doesn't happen in those dates. Providing enclosed cabs with HEPA filters on heavy machinery. So, like if we have someone working on like a truck in the field that it's closed in. Stopping or moving work on dusty, windy days. So, knowing that those days are the more risky ones. We also have a website that we'll put in the chat at CDPH that's called couldbevalleyfever.org, and it includes a lot of tips for outdoor workers and their employers on how to protect yourself, workers from valley fever. So if you think you or someone you know has valley fever, you might want to see a healthcare provider. You can visit a primary care doctor, urgent care, or an emergency room, and specifically ask the healthcare provider about valley fever and tell them if you have been in an area where valley fever is common, had symptoms like exhaustion, cough, trouble breathing, fever, chest pain for more than 7 to 10 days, and if you've been around dirt or dust outside, or if you work outdoors. And this is going back to like at the beginning of the presentation when we're talking about symptoms, and we're like, these symptoms are very non-specific. So healthcare workers, how we are trained to think is we usually just go to the most common, the most likely scenario and then zone in. But that's why knowledge of this disease and knowing that you or another worker is at a heightened risk and bringing that up to the healthcare provider is so important. So what can you do about valley fever? So knowing where valley fever is common and its symptoms. Avoid breathing dirt and dust in areas where valley fever is common. And remember, by avoiding being outside, closing the windows, using N95 protectors, talking to a healthcare provider if you have or someone you know have symptoms that last for more than 7 to 10 days. So remember persisting symptoms, but also worsening symptoms. And then visiting couldbevalleyfever.org, and you can find more resources there. So what is the state doing? What is CDPH doing about valley fever? So we're working a lot around providing provider education discussions, partnering with community organizations, creating materials for providers and community members to increase knowledge about valley fever, and also collecting information about valley fever to learn more about it. And I just want to close my presentation with the story of Juan. And this is what this story is made up, but it is very similar to stories of real valley fever patients. So imagine a man named Juan who lives in Monterey County. He works in agricultural fields and is a healthy 38-year-old. So in his work in the fields in Monterey County, there is a lot of dust, and this dust can go up. Look at that picture. So that's like a very typical picture of like what Juan's work they would look for, like. So a lot of heavy machinery putting up soil, and we know that dust can get in the air. So Juan, who was a previously healthy 38-year-old, starts to get sick. He starts with a cough and a fever. At first, he's just like, oh, whatever, like this is like my kids brought it from daycare. And he still tries to work, but he starts getting too tired and exhausted and has to stay home. So like he cannot like do his labor. Juan and his family aren't sure what is causing this. Because usually when Juan has a cough or a cold, it just gets better in about a week. He's starting to worry about avian flu and other things he's heard in the news, and which has been a concern for farm workers in the past. And he's seen a lot of birds fly nearby in the fields and wonder if that could be it. He's also heard of valley fever from his family in the Central Valley, but he doesn't think valley fever is a problem in Monterey, where he lives. So Juan goes to an urgent care clinic, and because of Juan's symptoms, which are very inspecific, his doctor tests him for COVID and flu. He does like a nose swab, but his tests are negative. So the doctor says that they're not flu or COVID, so it's probably a virus and it will get better on its own. But Juan's symptoms actually get worse. And he has trouble breathing. So now it's just not like some symptoms when he's doing a lot of physical work. Now he's like resting and having trouble breathing. So he goes straight to the ER. And in the ER, he gets a chest scan, and the doctor tells him he has pneumonia, which is a lung infection. So here you can see on the X-ray, you can see some like dissemination. Here you can see like some masses here, and they're like, oh, like there's something in your lungs, you have pneumonia. And the ER gives Juan antibiotics to treat disease infections and send him home because the biggest cause of pneumonia is a bacterial infection, and that's what they treat him for. But remember, valley fever is a fungus. It's not a bacteria. Antibiotics don't work on fungus. And Juan continues to get worse. Eventually, Juan gets so sick that he has to go to the hospital. And finally, the doctors do a blood test for valley fever. A few days later, it comes back positive, and Juan's doctor recommends that he takes an antifungal medicine because he's very sick. And now the disease is starting to spread. Juan goes home and he slowly starts to get better. Juan keeps in touch with his doctor and does repeat blood work to make sure he keeps getting better. After taking 1 month of work and being unable to work, he feels healthy enough to get back to his job, even though he's still getting tired easily. Juan will have to take the antifungal medication for a few months. So in this story, which is like a made up story, but still resembles the story of a lot of valley fever patients, Juan, it took like 3 weeks for Juan to get tested for valley fever, and he was sick for 2 months. If Juan or his healthcare provider would have known that valley fever existed where he was working, maybe he would have gotten tested before. And this is why, like, I mean, obviously it's a shared responsibility between like health workers, but also like empowering employees, employers, agricultural workers, people that live in this area to know about valley fever can really help make the diagnosis sooner and prevent severe disease. So that's it. I'm going to stop sharing my screen. And yeah.
Wonderful. Thank you so much, Lucia.